The clinic was not quite what I expected. Perhaps because we were so close to Halloween, I thought it would look something like Dr. Frankenstein's laboratory, carved out from the side of a cliff. Instead, a plaque informed me it had been a grammar school since 1908, and even though they had recarpeted the place and filled it with framed Mondrian posters, I still had the telescoping sensation of entering the battleground of my old childhood. I sat for a few minutes in a plaid chair across from an old lady with a green shawl and a knitting bag, and then was told that Dr. Cerletti would see me now. The sign on the door, Cerletti, electroconvulsive therapy. Miss Wells, I see here we have an informed consent from Dr. Gruber, is that right now? Yes, doctor. I looked around the room for the device that would cure me. You did a pre-treatment evaluation for us, is that right? I've been depressed, I told him. We've tried pills. Nothing seems to work. That is the only reason you would be here, Miss Wells. Dr. Cerletti looked at his clipboard, which could have no further information. Do you mind if I ask you a few questions? Only if I get to ask a few. I'm terrified about the electroshock. We call it electroconvulsive these days. And I know what you're thinking. I'm sure Dr. Gruber went through all this with you. No data suggests any kind of damage to the brain. He smiled, and the smile on his bland, kind face was reassuring. Things are very different than they used to be. For instance, I'm going to give you thiopentol, an anesthetic, which means there's no convulsions like you might have worried about. Nothing like that. It'll be much nicer than going to the dentist. That's sodium pentothal. Will I tell you the truth, doctor? Were you planning not to? It doesn't actually induce truth-telling, it just lowers the patient's resolve. That sounds like the last thing I need. For right now, it's just what you need, he said, writing something down and frowning. We'll do this twice a week, a course of 7 weeks, and then will be a reassessment, but I expect we'll do another course of 7. We'll be over by February. It will help you make it through what seems to be a very hard time. I understand your brother died recently. Among other things, I said, staring out the window to where a school used to be. Will it change me? I asked the doctor. Dr. Cerletti considered this very carefully. Miss Wells, not at all. What has changed you is your depression and these episodes. What we're trying to do is to bring you back. Bring me back. He smiled again and took a deep breath. You might experience some disorientation afterwards. That's perfectly normal. What kind of disorientation? Please lie down. A slight dizziness, probably just possibly hallucinations, not knowing where you are, quite who you are for a moment. Some have auditory hallucinations, bells ringing, that sort of thing. That sounds serious. Lie down, please. It isn't. Patients say it can be like waking up in a hotel room. At first you're not sure where you are, but then you're yourself again. We're piecing you back together. Lie down. There you go. First the anesthetic. You won't feel anything electrical at all. The nurse arrived with 2 syringes, the anesthetic, and a muscle relaxant. I lay down on the crackling paper and I looked at the constellations and the acoustic ceiling tiles. They seemed so close. I closed my eyes. The doctor said that I would feel the first injection but not the second, and that it would only last a minute while he administered the procedure, which would be 1.5 times the seizure threshold for a woman my age. I thought back on childhood fears of needles. I reminded myself I was far from childhood. I felt something metal attached to each of my temples, and then the cold swab of alcohol on my inner arm, and then the awful pinch of a needle going in. I held my breath. Almost immediately an unpleasant odor filled the room, rotting onions, my mind unlatched, and then I found myself elsewhere. Don't bring me back, I remember thinking. Take me away. As for what I felt, later I would come to think of it as being cut out of the world. The sensation, not unpleasant, but more like the shock of cold limbs immersed in hot water, of the draft being removed from my skin, the crackling paper caught from my back, the air from my lungs, so that I hung for a moment utterly separate from my surroundings, cut out of the world as a gingerbread man is cut out of dough. cut out and taken who knows where. What do you call the time when we're missing? The time, for instance, when we've had so much to drink that minutes stutter by with blanks inserted, or whole hours are lost to us, and yet we were there and said and did those things and are held responsible for what occurred. Or even the little lost moment when we awaken to find ourselves partway through a phone conversation and have to explain to the person on the line that they've been talking to a sleeping person, and that only now are we present. And what is that gap time called? What part of us is functioning? Are we to blame for what we do? And finally, who are we when we're not ourselves? There, I opened my eyes. The doctor was smiling at me under his little mustache, and I noticed a drop of perspiration between his brows. You may feel a little hangover for the rest of the day. I looked around at the same room, unchanged, just slightly underwater, and then I said something very odd, which made him smile. Where are the what, Miss Wells? I'm sorry, I must be dizzy. Do you think you could walk home? I told him yes, of course. He nodded and he said, now what's most important is to call me if you feel anything at all strange in the morning. I think you'll notice a shift. He'll be back tomorrow and then we'll set it up with Marcia. He smiled at his nurse, and as she left the room, he gave her a little pat on her behind. The nurse, a little red-headed creature with big eyes and a sideways nose, brought out my clothes and waited for me to change, a little grin on her face. Perhaps it was from the doctor's pat, or perhaps it was from my funny little question, while still under the anesthesia. Doctor, where are all the children?